Good morning, everyone. Thank you for joining us today and welcome to the 55th session of Majlis Al Khonji. Today, we have a very important topic about the future of healthcare with AI and emerging technologies. Please allow me to introduce our guest for this session, Dr. Abhay Chopada, a renowned consultant surgeon in London, UK, considered as one of the top 10 in UK. He is also the founder of award-winning AI platform that is globally transforming the healthcare. He is a passionate healthcare entrepreneur and an active investor with companies transforming healthcare, with a global experience spanning over 26 years in medicine, healthcare, and health tech. Dr. Chopada is alumnus of the University of London and completed Ready Now program at NHS Leadership Academy. He has been recognized by Tackler magazine as one of the top GI surgeons in the UK since 2007, and he is a recipient of the Top Doctor Award by Doctors UK 2019. With a passion for human physiology combined with innovation and data sciences, Dr. Abhay co-founded Clean Vantage Healthcare Technologies, an award-winning SaaS-based data platform to unlock the AI-enhanced healthcare insights. It also ensures real-time access to healthcare data to caregivers and patients for transparent and safe care management. The future of healthcare will be driven by predictive medicine, allowing AI-driven insights to prevent serious illness like heart attacks and stroke cancer. Dr. Abhay has volunteered with several organizations and helped strategize around technological innovation that supports positive patient outcomes. He is also actively involved in strategic and executive roles with healthcare institutions from operation transformation. Welcome, Dr. Abhay, to Majlis Al Khonji, and I would like also to welcome our moderator for this session, Dr. Dina Al Asfour, an expert in public health, DPhil in population health from the University of Oxford, a WHO consultant for a number of projects in the Middle East and globally. Welcome, Dr. Dina, and over to you and our guest. Thank you very much.
Thank you very much, Reham, and I welcome Dr. Abhay. It's an honor to have you here. Artificial intelligence has become more important than anything else during this year. And as we have realized through the COVID times that we really need to make health available at the least human interaction. So it was challenging for many people, as you all know, in Oman, to come to, for example, to attend to their clinic in the Royal Hospital, as the Royal Hospital closed many of its clinics during the COVID times. So how do we solve that? How do we go about it? And this was also complicated by the rising cost of healthcare during that time. So where do we allocate our money? Probably artificial intelligence would give us the answer. So without further ado, let's hear from Dr. Abhay and then start asking him questions. Dr. Abhay, please go ahead.
Thank you very much, Dr. Afsoor, and welcome everybody. It's a privilege to be talking with all of you. As I was introduced, that I'm actually a practicing surgeon with a deep interest in looking at healthcare from a completely different perspective. The perspective of actually how do we actually ensure that we can give equitable healthcare to all, irrespective of which country they belong to, or whether it's a rich nation or a small nation. To start with, COVID has exposed the underbelly of healthcare today. The moment we had a pandemic start here in UK, our healthcare systems really started collapsing. And we are talking about one of the most developed nations. The reason for that is healthcare today is completely physical. When you look at it, you are expected to go to a hospital, or you are actually expected to attend a clinic in order to get your healthcare. However, when I look at every other area, that has long changed. Think about it. Now the bank comes to me. If I want to withdraw money, the bank is happy to send me money home. I can do all my financial transactions using my smartphone. I can actually speak across a continent or even to a different planet using technology. So I took the idea as to why can't we do the same with healthcare? The major challenges of healthcare today are that of access to healthcare, because access to healthcare is limited due to physical availability of a doctor. Affordability, because healthcare is very expensive. It might be affordable to people in the higher socioeconomic strata. There is still a huge chunk of this planet where having a single episode of healthcare results into lifelong poverty. And the most important thing, a changing behavior of people who are now adapting technology way better than before. But I'm going to keep my talk really simple. I'm going to show you the power of AI over the next few minutes. It started with a thought a few years ago. I was looking at all the media reports where we were talking about driverless cars, autopilots in flights, but people still drop dead with heart attack or stroke. The question was, can we not figure it out in advance? Can we not stop a heart attack? Can we not stop a stroke? And this is what really got me interested into AI. I started realizing that it is actually possible to build predictive health, but we'll have to start in a very simple fashion. When I look at the smartwatch from Apple or from Samsung or the Fitbit, one thing is certain, I now can monitor the human body 24/7. Now, if I start collecting medical data in a correct way and collect all this data that is coming 24/7 out of the human being, I can start building patterns which can predict the chance of getting a heart attack or a stroke. The thought is that simple. Of course, it wasn't very easy, but I decided to give it a shot, and this was 4 years ago. Why was this important? Because remember one thing, if we don't start this journey, we are going to continue looking at a disrupted healthcare which is inaccessible and frankly cruel. Over the next few minutes, I'll show you the demonstration of our CliniVantage platform that is built to allow any data to interact in real time to empower the clinician and the patient alike. Today, it is possible for us to create a mobile single citizen, single medical record with full device integration. This can help us with any future pandemic situation or even to manage care at home. We will show you the demonstration over the next few minutes. So Nilesh, if you want to now actually just start sharing the screen, but seeing is believing. So Nilesh, if you want to just share your screen, I'll stop sharing mine. But over the next few minutes, I'm going to show what we've built on the top of the CliniVantage platform. The core thinking is very simple. Healthcare has to be patient-centric. It can no longer be what it is today, where a patient goes to a doctor. Why can't the care be provided to a patient wherever he is? I might be sitting in a city in, let's say, rural India. I should be able to get an opinion from New York if I want. A lot of people started on this journey thinking this is just simple telehealth, but it isn't. I can tell you the key part about transforming healthcare is about data management. I can tell you today that majority of us do not have our medical records with us. When you go to a doctor, you might get a piece of paper, or you might get one lab report which you keep in your file and lose it. But what if we actually said we will build a system whereby all your medical data is automatically available to you 24/7 in any language, anywhere? Such a simple thought, but such a transformational thought. We said it is possible, and we built this technology whereby you can have a chest X-ray in Mumbai and an ECG in Muscat, and it wouldn't matter. You will have access to all your medical information live from anywhere, anytime, anywhere in the world. This is important because if I don't have access to your health information as a doctor, the first thing I have to do is start checking your background health. I spend a lot of money, your money, to find out how well or unwell you are. The simple thing is actually transformational. A lot of governments are now talking about a single citizen, one medical record. But is it that simple? So we said, no, let's now go to the next level. Why can't we make every medical appointment automatically create the entire documentation, which will be available in any language, anywhere? So let's assume you see a doctor in Muscat today and you're traveling to US tomorrow. It shouldn't matter. Your doctor is generating a case sheet which is very rich in data, a structured data. Now, the moment I am actually in the US, I can allow the doctor in the US to see this in any language that he wishes. I can see this in Arabic if I want. I can see this in in Swahili, in whichever language, 140 languages. And at the same time, I'll maintain your original documentation so that there is no discrepancy possible. Why is this important? Again, this is vital because if your medical records are available in any language, anywhere, it allows the doctor to see your medical records and transact accordingly. Nilesh, do you want to restart? Because I think you are having a glitch there. Now, this was part one. Nilesh, just go back. We can come back to this feature a bit later again.
Just take a second.
The second aspect of this was, okay, it is fine to have medical record, but what about access to a doctor? Now, today I can sit in London and I can book a ticket from, let's say, New York to San Francisco. It doesn't matter where I am. I can make my bookings. So we said, why can't we build an exactly same system where you can book an appointment to see a doctor virtually or physically anywhere in the world? So we built that system as well. Nilesh, if you want to just re-log into, because right now we are seeing a blank screen. Can you screen share again? I think your app is stuck.
No, something is wrong with the screen share. Just give me 1 second. I'll just redo that.
But we took the same concept as to why can't you make an appointment from anywhere, anytime? And again, like I said, this is an extremely powerful thought. Think about it. Today, a lot of people actually have to travel. People might be traveling from the village to the city, or some people have to travel from one country to another country to get their medical care. And medical care is 80% about an opinion. It is not always about actually needing to do any intervention. So Nilesh, if you want to go back to the document, we'll show how every report is available in any language, and then we'll come to the appointment if possible.
Yeah.
So we were showing you the medical record earlier, and I'll show you how that record can be available in any language, anytime. So the moment I now go to the case sheet, a case sheet can be translated into any language. I think there's a problem with your translation side.
Yeah, something is wrong with the network. It's just bandwidth. We'll just come back to that a bit.
Go back. We'll come back to we'll show the device integration first. Nilesh, do you want to go back or you can't? Again, it's stuck.
No, something is wrong with the screen share. Just give me 1 second.
Technology, it has its gremlins, though it is very useful. So let me just come back and I'll show you. So the first part was actually access to your medical information. And the second part was actually being able to push your information to the doctor. So we said, why can't we make an appointment anywhere, anytime? And Nilesh will now show you how you can make an appointment. And literally at a click of a button, you can not only choose a doctor anywhere in the world, but you can also make an appointment. We demystified this process as well. What we said is you can not only book an appointment, but why can't you talk in advance to tell the doctor what is wrong with you? Why do you have to wait to see a doctor? So we allowed a patient to talk in his own language. to tell the doctor what is wrong with him. And Nilesh, we want to show this particular
तेज
feature.
बुखार और सर्दी खांसी है.
So, literally as he talks in his own language, this will be available to the doctor in his own doctor's own language.
High fever and cough.
So essentially what we are saying is we can demystify the medical process, but we didn't stop here. Now we said, why can't we use the power of AI to recreate what the doctor does in his surgery? So Nilesh, if you can skip the payment gateway, please. And what we will do is we will show you how you can actually be sitting in your home in your own time and still be able to give the doctor all the history that he would need as a part of his appointment, even before you've gone there. Now, this is very important because if you think about it, 70% of your medical appointment is essentially just history capturing. Doctors take shortcuts there. Why can't we talk with the system and tell in advance what is wrong with us? So let's assume we have fever. Now I will show you, we actually can go through a very structured history exactly like a doctor will take, because this is a contextual engine. This is an AI-based engine which will behave like a doctor, ask you the right questions. You don't have to type anything, you can talk with this, and this will get pushed to the doctor, so the summary will be available to him. This is very important because what we are essentially allowing it to do is we are recreating the medical appointment without physically being there. Now, this is just one component. So what Nilesh is doing now is giving the history to the doctor, what medicines you take, what surgery you have had. Nilesh, if you can skip this part, please. But this information is now available to the doctor in a snapshot. Now, imagine if I can do this while the patient is still in the village and he's accessing a doctor in the city. Then we said the second part is how can the doctor start checking the patient? So Nilesh, show the vitals piece now, show the device integration. What we did was we took a lot of devices that are medically approved. These devices take medical information, but that device will push that information live to the doctor. So now this is a device which Nilesh is showing on his screen. This is a small device. This does 7 vital functions: temperature, pulse, blood pressure, ECG, heart rate, blood glucose, and respiratory rate. You are doing this at home and the doctor is seeing the result. You don't have to call him. You don't have to tell him anything. The report is automatically available to him. This is the power of technology. Now imagine that if I actually in COVID era, keep the patient at home, but check his chest, check his heart, do an ECG, check his oxygen saturation. You don't need to admit a patient to the hospital. This is not only a device, by the way. I'm just showing you ECG for a moment, and then I'll show you a few other devices which actually achieve the magic. So you can imagine, I can actually see your heart, I can assess you. This is one device. We've taken a 12-lead ECG. I can do a urine analysis. I can do 120 blood tests. I can even do an ultrasound scan at home. The technology now allows you to have your own ultrasound machine at home. I will show you on my screen. A very simple device, and this costs you 500 pounds, the same cost as a TV. Imagine you are unwell, you're keeping the ultrasound in your tummy, and your doctor anywhere in the world can look inside your abdomen and tell you what is wrong. That is the power of technology. A lot of the times I get asked, but how will the doctor check you? Look at this little stethoscope. This is a personal stethoscope. You will have it. Keep it on your chest, and the doctor can just plug this into his mobile phone and listen to your chest. Nothing magical. It is about thinking as to if we are smart enough, the doctor can be anywhere in the world and I can get my care. Whether it is diabetes, whether it is neurology, whether it is a heart attack, it doesn't matter. Dilesh, now go back to the doctor side, because we realize that it is not just about the patient. We have to start thinking, and Nilesh is showing you the translation feature now. So, the same, you've converted to Afrikaans, but, do it in Arabic now. Do it in Spanish. You show the same medical report in Spanish, please. So the concept here is your medical records are one of the most important documents that can save your life. I don't mind if you don't have your passbook or your bank balance, but if you don't have your health records, you potentially are putting your life at risk. So that is the way we took in building this system. Nilesh, go back, please. Go back, yeah. So we now show the vitals. Now I will show you one more magical feature. A lot of the people ask me, but what if I don't have the device? You might not have the device today, but believe you actually have a supercomputer in your pocket. I'm now going to show you how Nilesh is going to just look at the smartphone, and I will now be capturing his heart rate, his respiratory rate, his SpO2, his temperature, his blood pressure, even his blood sugar, and his hemoglobin. That is the power we have in our pocket. That is where AI is coming in. After a while, it is not impossible to imagine that the diagnosis of your medical condition will be done by your smartphone, not by a doctor. The doctor will be just there to take a decision based on, look, his heart rate is visible, his respiratory rate is visible, his blood sugar is visible. And this is all happening with real science. This is all getting validated. This is what's happening today. And as we get more mature in this area, as the camera gets more powerful, believe you me, 80% of your diagnosis is going to be happening by yourself, not by a doctor. I'm very excited about this area because this is how interaction is changing. Nilesh, if you want to now share the voice bot that you have. So what we did was we said, okay, but what about interacting? You know, the doctor needs information, but I'm not always confident about using a smartphone. I don't feel like it. So we said, why can't we build a virtual nurse who can do the same thing? So Nilesh will now show you a virtual nurse. Can you imagine you're unwell, you go on your smartphone, you talk with the girl, you tell her what is wrong with you. And immediately that information is going to decide what treatment you need. That is the future. A future is going to be where the doctor is going to be less and less important, while technology is going to be more and more important. And that is how we can solve a lot of the problems about rural health, public health, pandemic management.
Please help me with your symptoms.
Nilay, just show the end as to how the summary gets created.
I'm here to help you. Please help me with few questions before we go ahead.
No, do not activate at night.
Let's go to the end, yeah.
If your symptoms are being checked, and doctor may advise you soon.
So this bot has done exactly what a doctor was supposed to do. It took the history, but it can give you advice. It can tell you about taking your medicine. It can remind you. So this can act as your personal nurse. Can you imagine the power? So I don't have to interact with technology in a technology way. I can humanize it. Nilesh, now go back to our practice management system. This was one part of the solution. Then we said, how about making sure that the healthcare professionals interact correctly? Why can't we build a system which will work for the doctor? We hear about all the Cerner systems and EMIS systems, and I'm surrounded by them. Except those systems don't work for me. They expect me to work for them. We said, why don't we build a system which will be available in any language and will do my work? So this is a system that can be translated to any language, anytime. So, I can switch this to, let's say, Spanish if I want. Nilesh, if you want to show that, please. Make the whole PMS become Spanish. And the second thing is zero typing involved. A doctor can do all his work without any need to even pick a pen or paper. He can do it in one go by just looking at the system. Nilesh, why don't you just convert it to Spanish? The whole system. And the idea here is the doctor should have this luxury to use it in any language. Let's assume if I'm comfortable in Spanish, I'll do it in Spanish. If I'm comfortable in Arabic, I'll do it in Arabic. It shouldn't matter. Your data should not change. Then we said the system should do the doctor's work. So there's a lot of automation and AI built in for the doctor, whereby the doctor's work will be done by the system. So doctor will see a medical file exactly like he does today, but a system will tell him what to do next. This is all built in. Okay, the system has become Arabic now. So, it is not difficult for us to use technology and use it correctly. Then we took the same concept for a hospital or for what I call a healthcare platform. Nilesh, if you want to go to the HIS part now, please. And we said, why can't we run an entire country's healthcare on a single platform? What is so difficult about connecting every hospital, every clinic, every doctor together? So it doesn't matter who the patient goes to. The information will flow correctly. So we built a very comprehensive health platform which accepts every module, whether it is an ambulance, whether it is a paramedic, a dentist, an emergency room, or even a mortuary, all on one platform. Not only does it clinical work, it also does your ERP, stock management, tendering, everything in one place. The thinking is very simple. When you simplify healthcare, it becomes efficient because the data will allow you to build your insights, your intelligence, and be very simple about managing healthcare. This is the first system in the world where the doctor can sit at home and do a full ward round of all his patients in the hospital. No need to travel. Why can't I do it remotely? I have the technology. I can build all the imagery, the data mobility, everything in one place. So we did that. Then we said, okay, now this is fine. We've built the technology. How can we make it practical? So we decided to do an experiment in rural India. And we took all the devices that we had and built a health ATM. Nilesh, if you want to share the slide of our health ATM, or if you stop sharing, I can share it. Either ways, it's fine. Show the health ATM now. Yeah. So we took all the devices and we said, why is it so difficult? Why can't I just have one machine that can be put in a village? It can be put in a pharmacy. It can be put on a railway station. It doesn't matter. When I need to access health, I'll just go to this. There will be an attendant. I can connect with any doctor anywhere in the world. I can do all my checks. This machine is capable of doing 120 blood tests. It is capable of doing an ultrasound. It is capable of checking your chest. It is capable of looking into your ear. It is capable of looking into your eye. It is up to us what information we want to pass and which specialist we want to connect. We can transform healthcare using interactive machines like this because no longer is it necessary for you to have a specialist in town. Your specialist can be in another country. It can even be on another planet. As long as my data is going to the doctor can make the right assessments. The ATM will push you a prescription. It will print it out. You can go to your local pharmacy, get the drugs delivered to you, and the episode is solved. 70% of medical care does not need the doctor to physically do anything. It just needs an opinion. It just needs a prescription. Only 30% of the times when you need to actually get admitted because you have to have an endoscopy or for that matter, you need surgery. And slowly, even for that, robots are coming in. So if we think about it, this is the future of healthcare. This is what excites me. This is what makes me realize that if we think it correct, healthcare is for us to make it really smart. Today, when I go to a hospital and I see a queue for people to check in, it really breaks my heart. I'm saying, listen, I go to an airport, I scan my mobile phone, and they know who I am and they know all my details. But when I go to a hospital, I have to stand in a queue. Why? So we've built that smartness in our technology. You go to this ATM, the ATM will know who you are. It will do a face recognition and welcome you. It will push your data to the doctor that you're connected to. It is not magical. This is all absolutely happening today. This is proven. We are actually looking after 36 villages next to Mumbai with one ambulance because technology is allowing us to do that. So Nilesh, now if you want to give me sharing, I'll show the remaining bits.
Yeah, you should have access to it.
Perfect. So what I want to say now is I'm not going to talk too much about this. I think you got the message that as technology is coming in, we all can see a massive transformation. This is a huge area. Healthcare spend is only second to defense spend in the world. It is a multi-trillion industry. And remember, this is where the difference was between landline and mobile only 10, 15 years ago. Today, landlines don't even, they are right in the periphery. That is what is going to happen in healthcare. Platforms like clean advantage is a huge ROI opportunity. Digital health is now going to replace brick and mortar and devices. Especially if anyone in this forum is interested in manufacturing, believe you me, I'm looking for people who want to create health hubs, want to manufacture these ATMs, these health boxes. We already have the patents. We already have the full know-how. We already have the platform. It is for us to forge the partnerships to take it to the next level. I'm going to show you only one more slide. This is what I'm really working to. I already have the ability whereby you don't go to a doctor, you go in front of your mirror when you brush your teeth. The mirror looks at you and assesses how well or unwell you are. And it'll tell you that, hey, your blood sugar is trending up. Do you want to make an appointment to get your diabetes checked? Not for you to wait till you're unwell. This is true preventive health. This is how we're going to stop the heart attacks, the strokes, because we need to understand that by listening to the human body, it is possible for us to find out patterns that can predict events like cancer, heart attack, stroke. And we will be building these tools. This is just the beginning. There are millions and millions of bright minds all over the world which are working on individual pieces. We've built a platform to connect all of them together, to say that, hey, tomorrow belongs to us. We are not happy with the healthcare as it is today. We have to invest in connected healthcare that really can transform. The mirror that I'm showing you today is available. We've already created the prototype. Again, if someone wants to take the leap of faith and say, we want to manufacture this, it's available. At this point, I'm going to open for everyone else's opinion to come. And thank you so much for giving me a chance to present my work. I'm just going to say a big thank you. And I will stop sharing and open the forum for questions and answers.
Now we will open the forum. Thank you very much, Dr. Abhay. That is very, very impressive. It's beyond what I was thinking even. Thank you very much. Now let's take questions and answer. Please raise your hands if you have any questions, or just mention that in the chat.
Yes, Dr. Dina, we have a question from Mr. Nick. Please go ahead.
Please go ahead, Mr. Nick.
You're on mute, Nick.
Beginner's error, sorry. Doctor, I'm reeling from your extraordinary vision. I found it absolutely fascinating, and you explained it with a clarity that many people don't have in your situation. I have two questions. One is, are you in any way understating the difficulty of creating global interfaces, regularizing the interfaces that will be needed to take benefit of this? The other concern I have is that the protection and security of data when it's traveling the globe, if you like. Thank you.
Thank you very much, Nick. I'm so glad you asked me the exact two questions that we started our journey with. Now, today, the fact remains that 95% of global healthcare is not even connected. It is not on any platform. It's paper and pen. The remaining 5 to 10%, which typically is the Western world, care is connected, but we do have standards for interconnectivity with HL7 and FHIR. So when we built this platform, we made sure that we can talk with any system, and we have our own integration engine. So I can take data from any system and make it really work, number one. The second key aspect is data ownership and data security, one of the most major challenges of today's world. Data security, I'll tell you, we made sure that we actually are fully compliant with the latest global security standards. We are SOC 2 compliant, we are HIPAA compliant, we are GDPR compliant. But the most important, simplest thing, data ownership. I am the first to say that data belongs to the patient, not to the doctor or the hospital. By sharing a copy of your data with the patient, we can unlock the geographical barriers that have been created by different jurisdictions, because every individual has the ability to decide where his data is shared and where it isn't. The second thing that I did not highlight, I've given the full power to the patient to decide which of his data is shared and which is not. That is true data ownership. Data ownership is not just say I will give my data or not. Data ownership is being able to decide that I don't want to share my sexual history. I don't want to share my psychiatric history, but I'm happy to share my cardiac history. Let the patient be the judge. I have to say that the future is about a partnership with individuals. It's not about a hierarchical relationship where the doctor knows it all and the patient is just a passive recipient of advice. Internet really broke one barrier in the world, that was about information. So nowadays I always say I learn from my patients, and I really do. So the future, like I said, we made sure we are fully compliant. And of course, the regulatory scene can change with every country, but we are willing to learn and adapt. The key is about saying that, listen, I don't see anything as impossible.
Thank you very much, Dr. Abhay, for this comprehensive answer. Actually, the data security is quite a complicated and dogmatic area, may I say. So yeah, at some point in time, people have to come into grips with one standard of security and ownership of data, especially medical data, because right now I feel it's quite fragmented. Now we have a question from Dr. Ramin Muhajir. Dr. Ramin, please unmute yourself and go ahead.
Thank you, Dr. Dina. Dr. Abhay, thank you so much for a very comprehensive and eye-opening presentation. I'm not a medical doctor, so pardon my ignorance if I don't understand some of the things. But I have two questions that I'm sure you have addressed in your line of work, but it would be nice to enlighten us. One of them is that there is a problem of connectivity around the world. So when things are depending on technology and AI, you need to be connected first. And I think the next stage may be of telecommunication where you don't need actually local satellites, and you can directly connect to international satellites. That would definitely help connectivity in rural areas, which is basically what you're focusing on, because in the cities, I don't think people have that much problems. It's most of the world which is secluded and in rural areas. So that's issue, how to address it, maybe in connection with telecom companies and other things. The second question is, once all the diagnosis, through how you explained, is established, there comes the stage of the medicine and getting the actual treatment. Is your thoughts on using drones, for example, to get to rural areas and get the actual medication to them? So diagnosis is one side of it. Me actually getting a treatment in a rural village in Oman or in India or anywhere, that's another challenging thing that I think, I'm sure you have thought of it, but it would be nice to let us know. Thank you very much.
Thank you so much. I'm so glad. Again, like I said, I'm learning. So let me address the first part, that mine is a journey of partnerships. I do not expect to transform the world alone. So when it comes to connectivity, let me address that first. So I am seeing a world that automatically is transforming from a connectivity perspective for various reasons. So even in rural India, now I get a 2G signal at the least. Majority of India is now 3G. So when we experimented, we said, how can we use the least available bandwidth to still be practical? So we created a hybrid model. So we were smart there. We said your data doesn't have to travel all the time. What if I created a local hub for the doctor? So for a village, my data stays in the village and it synchronizes with my central servers only when there is electricity and a network. Now, by thinking slightly outside the box and creating a model whereby you serve both the masters, we could win. Because remember, today it is tricky. I don't always have electricity in every village of India. So we said, why can't we just actually be smart and do that? And it worked. We did this for 7 months, by the way. The second aspect of this is that space, there are two, the government is actively, every government in the world is really looking at connectivity. There's not a single government now that actually does not try to do that anymore, right? And Nilesh is showing you a picture of where we are doing that in India as we speak. There are 36 villages where we've put the ATM inside an ambulance. And there's no doctor. The doctor's sitting all over Mumbai, and they're still looking after these villages which are standing in a queue for the healthcare. And that's Nilesh. Nilesh, stop sharing because you're taking the thunder away. The second aspect was about partnerships. There are other aspects of this where there will be different requirements, not just from data connectivity, but also about portability, also about devices. So we believe that we will not try to solve every piece of the puzzle. So when it comes to drug delivery, yes, there are companies which are doing drone drug deliveries, right? But what is so difficult about the government to say, listen, why we will create an ATM which will dispense drugs. You just need to send a code and we'll have all the drugs that are routinely needed. And you just press in the code or flash a card and you'll get your drugs there. It is about thinking. Is it really changing what we are doing? It doesn't, because the drugs are all there. So instead of thinking that how will we deliver, it's about saying how will we distribute drugs. Now, today we keep a lot of stock of drugs in rural dispensaries and clinics. Now, instead of that, if I just unlock it and keep it in a technologically empowered machine, I can make it available 24/7. So it's like I said, I'm not going to solve every problem, but I'll be willing to work with entrepreneurs who want to work on those aspects and solve it in their own way. So like I said, I see this as a journey of partnerships. Like I told about manufacturing, that's not the only area where I'm looking for partners. Global health is not going to be solved by only one person or one group of people. It is going to be a global partnership forged across multiple groups who will all contribute. They already are. And the challenger is this is about all of us. This is not just about an individual in UK or US. This is a global requirement.
Thank you. Thank you.
Thank you.
Thank you very much, Dr. Abhay. Now we have a question from Mr. Mohammed Al-Maskari. Mr. Mohammed, would you like to unmute yourself and ask the question, please?
Thanks, Dr. Abhay. Thanks, everybody. The question here, how would, for example, Ministry of Health or government would benefit from it?
Absolutely. Thank you so much. So, Mohammed, this is a dear friend of mine. let me say that we have to think. Let's say if I'm a government body and I can share with you that there's another government that has already engaged with us to pilot our platform to deliver national care. Think about it. As a government, the ability or the requirement from a government's perspective is to offer connected care. The government might have multiple hospitals, tertiary hospitals, secondary hospitals, primary clinics. Now, if you have a single platform that can connect all your different setups, essentially, you cut your costs down by at least half, plus your patient can go to any hospital and get a continuity of care. He doesn't have to carry any information, he doesn't have to carry any papers, he doesn't have to have any replication. From a public health model, I'll still be very keen to hear Dina's opinion here because she comes from that space. But our early experience says that this is very valuable for every space of healthcare. But Dina, I would be very keen to hear your opinion. You're the expert there.
Are you talking regarding the benefit to the government?
Yeah, of public health. How do we utilize a platform of connected care for public health?
Now let's. I would like to ask you before that a question. Do you think this would be more valuable to primary care or secondary care?
I don't make that distinction. To me, care is a continuum. The day we say primary and secondary care, we create a barrier. That is where a lot of problem happens. If we say care just means access to opinion, what happens is you might be in a village in a primary clinic, but you can get opinion from the tertiary center. So your primary clinic has become an extension of the tertiary center straight away.
Well, that's what I was coming at, because we have here in Oman, we have about 170 something primary healthcare centers. And I don't think we will ever be able, and considering the economic situation and what happened with COVID and the oil prices and all this drama that everybody knows about, that we will be able to fulfill the actual requirements for proper access to healthcare to every patient where they are. This is, I think, is a magical tool that can help us. A person, a doctor, a consultant who's sitting at the Royal Hospital or any hospital in Muscat can deliver the care to any village in Oman with almost like a very minimal cost to the patient and to the government. So I think this will go a long way. And I was actually going to ask you the question, but you said that it will reduce the cost by half. So right now, I'm sure everybody on the panel have heard that last year we had a budget of 800 million riyals. This year we have only 600 million riyals allocated to the Ministry of Health. So that is a big cut, and we need to live with that. So I think from that perspective, this tool would be or something like that would be very important. I don't want to speak too much. I think I need to get someone else on board. Dr. Zaid Al-Hanai, would you kindly, do you have any questions, Dr. Zaid? Would you like to come on board, unmute yourself and give us your views or questions if you have.
Well, thank you, Dr. Dina. I'm not really an expert in this field, but I do understand there's a big wave of increasing technology in healthcare that is coming. Personally, as a practicing doctor myself, I haven't yet reached a point where I can trust any device to substitute my presence there with the patient. For example, I'm consulting in infectious disease, and every time I get a consult, I try to read the whole chart and question the doctor who gave me the consult, and then in my mind, I try to make my own assessment and my plan for the patient. But almost always when I go actually to the bedside and I see the patient and I talk to the family and all of that, always my impression and my plan changes to the better. So I've been very much against any doctor who tries to manage things from afar. However, having said that, I do believe that these technologies with artificial intelligence will probably augment our assessment of the patients in a big way. And I wouldn't be surprised if in 20 years I'm completely replaced by these technologies, because the computer can calculate and analyze and observe a lot of things much faster than what we humans can do. And so it's really only a matter of time before these computer systems are better than us. So I think definitely it is the time to embrace this technology early on and be on board and know what is its, and try to increase its full potential. And I do think it will help with rural care, but it's not yet, I think, in prime time. Maybe Dr. Abhay will disagree, but definitely it is coming. Yes, Dr. Abhay.
Zaid, let me just say that I see myself in you. I was exactly where you were only a few years ago, and I still am. So when we build this platform, the one thing I always say is we are not about replacing a doctor. We're about augmenting a doctor. So when you say you're an infectious disease specialist, I'm a surgeon. And imagine how we feel when we say technology. We feel frightened because, it can be inaccurate. It can make errors. The first thing we've done in the platform, you'll see that in our content management side, which I didn't display because I thought it was a non-medical meeting. but I've augmented our decision making. Let me give you a very simple example. Let's assume I'm prescribing a particular new antibiotic, right? Now the system will automatically tell me what the potential interactions of the medicines are and whether I should expect a particular side effect or not. Now add to this the extra information we are already mining. We're getting genomic information. We are getting proteomic information. We're adding so much information into our medical data sciences now that it is humanly impossible for us to keep a track of everything. So I'm saying the first thing we have to do is empower the doctors. The doctors have to feel more powerful in control of the situation, and they have to be safe. So one of the things of the platform which I've not brought out today, and purely because I didn't feel that it was right, but I can see your sentiment, I can feel it, is about doctors. Believe you me, at no point am I even remotely suggesting that we should replace doctors. In your field of infectious medicine, there is no chance of an ATM doing the treatment. That patient is going to get hospitalized. But what if I said we can use the ATM to do screening for HIV or screening for malaria in the rural area, so the fever is immediately diagnosed and before they get unwell, they're brought in front of you. The thinking here is we have to just get out of our anxiety zone to say this is not about our replacement. This is about us getting smarter, and we have to lead here. This is a space where I really expect clinicians to lead, because without clinical leadership, this won't happen.
Yes.
We have to tell the guys what devices we want. We have to go out there and tell the scientists what algorithm we want next, not the other way around. I don't want non-medical people to come and tell us what we should be doing in our own space. So like I said, I completely concur with you, and I can see myself in you. But I will be very happy to spend more time with you to show these aspects of the platform.
Also, Dr. Abhay, you might want to talk about, there was a point raised earlier about the budgets and the budgets being cut. When we talk about the pre-operative and post-operative, even in bigger cities and most advanced, areas, one of the big shifts that we're seeing is in the post-operative care, which can actually reduce the overall cost of care and also increase patient outcomes. So I don't know if you, Dr. Abhay, if you wanted to highlight that and showing how budgetary constraints can be, implemented using the technology that we've looked at.
No, I'll answer it in a different way. Every cloud has a silver lining. That was a statement I'd put. There were two things that happened. The economies went downstream and COVID happened. Both of these are negative events, but both of them forced us to rethink as to what are we doing. When things are going well, we don't like to change. Human behavior is that when all is going well, we don't change anything. We say everything is going well. Why do you want to change? It is only when we see adversity, when we suddenly are faced with a challenge, we look at options. Technology is about saying, how can we use what we have and address and solve the problem that we have? So with COVID or with budgetary constraints, I see this as a solution. Post-operative care, my own area, I absolutely worry about it, because every time I get a readmission, I don't get paid. If my patient has surgery and he bounces back in the hospital after I've discharged him, the insurance company refuses to pay me. So, I'm worried about what I'm doing because I have to stop them from coming back. So I'm saying technology is helping me there. Now I won't let them go home if the trends are wrong.
Right. So, Dr. Abhay, one more area that we can talk about where we've seen a huge improvement in patient outcomes and cost reduction was home care. Versus a patient going to a secondary center, it actually involves at least 4 to 5 people in a hospital. So the cost of that visit actually is much, much higher than a cost of a person going to home and doing follow-up care. And we've seen a huge shift.
That's classically demonstrated in diabetic care. Imagine when you actually have diabetes, the very simple things that we keep checking. Now imagine you don't even have to go to a doctor if you are a diabetic, but the doctor still he has full access to your blood sugars, your HbA1c, whether your urine is showing microalbumin, whether your eyesight is okay. Now that is the power. You don't need the physical interaction at all. You can still manage that entire disease using a platform. Your cost of care is going to come down by 20, not just 20, 30%. It is actually going to be less than half, because the human cost is eliminated. But you can apply the same thing into any chronic disease, whether it's arthritis, whether it's diabetes management, whether it's renal failure. To me, it's about saying, as a doctor, we are just going to provide the tools. You can decide how you want to use it and cut down and make yourself better.
Yes, absolutely. I agree with you, Dr. Abhay. Now we have a question from Mr. Simon Karam. Mr. Simon Karam, would you like to unmute yourself and ask your question?
Yes, thank you very much. Thank you very much. Thank you, Dr. Abhay. I extrapolated a little bit your vision and where you want to go, and I thought that we can think of the earth, all of it, because you said medical service should be given to any person, wherever he is, whatever is it. So I was thinking that the model can be extended to englobe the earth and think of the earth as a hospital. And in that hospital, there are people who are doing various things. And the World Organization is a doctor, a fantastic doctor who is controlling that hospital. He has in his hands the means. He's got the technology. He's got a medical team. In the technology, he's got devices. He's got artificial intelligence in particular, algorithm, and how to handle big data. This is absolutely fantastic. I made a little calculation here. So we are talking about 8 billion people and taking a very modest figure of 200 information per person and multiplying it by 140 languages, I reached a figure of 240,000 trillion so of information with data, which is totally, incredible. Excellent. It's a good dream. We can maybe one day reach that. However, I have to go out of medicine and think a little bit. I don't pretend I'm a philosopher, or metaphysical person, but let's go out a little bit. What are we trying to achieve here? Is it augment the length of life of people, or is it to augment their happiness? Or is it a part of both? And is it worth, when we know we're all going to die one day, all of us, whatever we do, whatever sensors, whatever, maybe people now talk about renewing a person where he can live 100 years, 200 years, and meet his grandparents, I don't know, or ancestors, or we meet Adam and Eve one day, you see. But we know, today, we know that life is going to stop. We believe in it, our religions talk about it. If it's going to stop, is it worth then spending so many trillions to extend the life by a few years? Or is it better to give food to all the people who are unhappy and make them happier? No, okay, that's one thing. The second thing, if I go from this macro picture to smaller picture, I'm taking myself as one patient in this 8 million hospital, 8 billion, whatever. Denial gives comfort. I don't want to know all the time if I'm ill or not ill. You see, I'm scared, I'm terrified. If I have to worry about the blood pressure as people worry about cancer, then I live all my life worrying. And I don't feel at this stage, as Dr. Zaid said, my question is, can I make a friendly robot that I can, consider him as a friend? Because you're eliminating a little bit the personal touch with the doctor. Finally, because, I have to stop somewhere. How do we pay for all this? In this Earth hospital, is there an insurance company that covers everybody? Can I go on this platform and say, I want to take the best professor, but he costs that much? Is that menu will be available? Shall I select the opinion of my, how does it work in terms of money? And but really, I thank you so much, because it's because of your talk that we started thinking about these things. You stimulated our brains.
Let me answer the first thing. What are we doing? And I'll tell you, I'm doing a very simple thing. If I want to live, I really want to live. I don't want to suffer. I'm not trying to increase longevity. I'm really trying to say this is about just having a productive life. If I'm going to die, let me die in a minute. The second aspect is fear. Today we have fear because we can't do anything when it is too late. To tell someone that he's got a cancer is effectively that person thinking in his mind, I'm going to die now. But what if he never gets a cancer? What if he never gets a heart attack? When I drive a car today, I'm not worried about my life. Believe you me, when cars were invented, the first fear people had was they were going to die in an accident. Today, my car has a dashboard where a yellow light comes, and when there's a yellow light, I take it to the garage. I say, you know what, look at the engine, get it sorted out so the car doesn't die on me. Now think, that is, the yellow light is what I'm building. I'm only building the yellow light so you don't get into trouble. You ask me a question, who's going to pay for it? And believe you me, you're not going to pay for this. This is going to pay for itself and save you money to feed all those hungry mouths. Because today, healthcare is a 3 trillion industry. Of that 3 trillion, you actually need only half the money to actually care for the people. The rest is all waste. We have never looked at healthcare from a holistic perspective. We spend 5 million for an MRI scan. If I get that information for £5, there's another company that we have, which is on our platform. I'll give you a simple example. That company looks at you, if you're feeling vertigo, you can look at the smartphone and it'll diagnose whether your problem is in your ear or not. Today, if you go to a doctor, he'll do an MRI for that. You do an MRI, that's a £2,000 cost, done, just because you felt fainting. Tomorrow, the smartphone is going to look at you and say, hey, you've got an inner ear problem, and that's going to cost you $10 to get it sorted. So you're not going to spend more money, you're going to spend less money. You're going to use less technology. You're going to be more human. Your doctor is going to have more time to spend with you. He's not going to treat you as if someone who needs to be just pushed out because he has to see 50 people. So this is about rebuilding the human bond. This is not about replacing a doctor. I completely concur with Zaid. And like I said, I understand his feelings 100%. We are trained to interact with our patients. We love talking with our patients. We love to bond with them. I'm saying technology should be there to help me. Technology should be there to make my life easy. So when we build a practice management system, I'll tell you, we are the first in the world where the system does my work. It helps me. It doesn't expect me to be a clerk who's entering data.
Also, Dr. Abhay, you had a point about multidisciplinary teams.
Yes.
Actually some of the best practices on how we're actually making that very seamless. So every citizen can really have access to some of the best specialties across the world.
So I'll give you a real life example. I'll take Zaid's area. So let's assume Zaid, we've got a patient on ITU who really has a very complex problem. And now I suddenly realize that now he's got neurological issues and cardiac issues. Now I want an opinion from a cardiac intensivist and a neurological intensivist. There's no hospital in the world which has all types of intensivists in one unit. But what if I gave you access to the King's intensivist and the Royal London Neurology Hospital intensivist at the same time, while the patient is still in Muscat? That opinion is what matters, because we are sending them the same data and saying, hey, this is the situation. What would you suggest? That intensivist doesn't give you any drugs. He's just going to suggest that, why don't you try this or tweak that setting on the ventilator and let's see where we go. A life can get saved. It is about augmenting doctors. Again, let me not take that emphasis away from saying that this is about saying doctors need a lot of help. Today we work in isolation. Today the concept is one patient should have only one doctor. Why? Why can't one patient be managed by multiple doctors? We can do it better as a team. It is about just being bold and challenging what is happening today. I know I'm a very passionate doctor and I'll take all the criticism on my chin, but believe you me, like I said, for me, this is real. This is the world I live in. This is my life.
Can I have a quick comment, Dr. Dina? Yes?
Yes, please go ahead.
Doctor, let me give you a little bit more noise and try to disturb your family. Instead of looking forward about 50 years, let's look backwards about 100,000 years. We know the rule of life here is life is given to the fittest, or the fittest survives. And if we go back about 20,000 years, there was no doctor, no medicine, I think. I don't know, but I think so. The question, and I don't expect an answer, of course, I said I'm creating noise more than anything else. Were these guys happier or not? And they survived. The proof is that we are alive today. They survived without doctors. But you did answer me. Of course, there's huge benefits of the work you're doing. Thank you for saying there will be savings and there will be more money to be given to the poor. But it's good that we expand our thought a little bit outside the discussion. Thank you.
Thank you very much, Mr. Simon. I think we have His Excellency Mr. Khamis Al-Kioumi, then Mr. Khalid Al-Blushi, then Mr. Anil. So, Your Excellency, can you go ahead, please?
It's you're on mute.
Khamis Al-Kioumi, can you unmute yourself?
I am here. Okay.
Please go ahead.
Thank you very much. It was very interesting, very, very interesting. Few months back, we were talking about studying from home, and then we moved to work from home. And today we are talking about medical from home, which is, I think this is one of the advantage of COVID-19. COVID-19 have pushed us to think in different way. And it shows us also that most of the world health problems was the capacity of receiving people physically in the hospitals, because the number were huge and whatever have been spent so far, not enough to take care of everyone. So this is also push us, and you put it rightly, Doctor, today in your presentation, to move from physical visit to virtual visit, and using artificial intelligence to overcome most of the diagnosis issues, and have a number of devices which can help everyone to access to the medical system, which you think that it can be created, and then get a proper advice without going again physically to the hospital, which I think this is very, very interesting topic. And I think this will be the direction of most of the places in the world. For me, the only question I want to ask about this is how fast this can be created and accelerate the changes in the today medical or healthcare system. Thank you.
Thank you so much. And I really appreciate your comments, but let me put it in a different way. I see this as a journey. I can be only as fast as my partners take me. As I said, the transformation is happening in front of our eyes. There's every area where there's an opportunity. You want to make the ATM, that's an opportunity. You want to actually have a device, that's an opportunity. You got a hospital that needs transformation, that's an opportunity. You're an individual doctor who needs a practice management solution, that's an opportunity. So I see that this is all going to be a collective, and it is going to be as fast as smartphones took over the world. Only 10 years ago, there were no smartphones. 1996, I remember my first smartphone weighed 1.5 kilos. 1.5 kilos. It was a brick, and I was so proud of it. Today, I actually have a power of a supercomputer in my pocket, and this is only going to get, improved. So it is up to us. How fast we can progress is entirely up to us collectively. The way I look at this is the world is ready for a change. The world needs a change. We all understand now that technology is the only solution. We all have to come together and, affiliate in multiple ways, whether it is a clinical arena, whether it is a manufacturing arena, whether it's a data science arena, and the collectivism is what is going to really make us do the transformation.
Okay, thank you, Mr. Now, Mr. Khalil Blushi, please unmute yourself and go ahead.
Assalamu alaikum. Thank you, Dr. Abhay. It's very, very interesting. This is what is called disruptive innovation and all that. I think what you get is the acceptance of people, which takes time normally, and it will come. The other problem you might face is that the coming along of regulatory part. For example, the new devices, the Samsungs and the iPhones and all that, they can give you a lot, but in many countries, they're still banned to give blood pressure and all that. Right? It is a matter of time, I think. But I can relate a lot with this because when we talk about remoteness, and I worked at sea on ships, and I think you can't be more remote than that. When we had issues, we have people who are trained on advanced medical, but they are not doctors, so they can do the first aids and a little bit more. But in 1935, a center, international center, was established. It's called International Radio Medical Center. It is based in Rome to help ships and the crew who get sick. So at the beginning, it was just over the radio. And then when the fax came, you took a picture of that person and send it. If he's red, if he's pimples, if he's this, if he's that. And then it became a little bit more with telephones and all that. So the principle was there to get remote help from a health profession. Now what they have, using the data and all that, a box which takes all the vitals of the person, takes all the information which is feeling and all that, and some of the things you need to feed yourself into the box. And this data is transferred to that center in Rome. And they come up with, to tell you, they know what you have as in your pharmacy. And they tell you, okay, this person needs this much, this much, this much, or this thing, this thing, this thing. So as a concept, I feel that it is going to be there, and it will be this ATM or a vending machine for pharmacy. These are solutions for remoteness, where the remoteness is there. Those who still don't believe and they need that interaction normally are in the cities. So that is the 30% you talked about, that you need to have that interaction. I just wanted this to comment on this. Thank you.
No, thank you. I completely agree with you. It's a very similar concept. We inherently understand the need to get the right opinion and push the right data. It is just that science now is evolving, where we have more tools. So what started as just pushing the vitals or sending a fax, today I can have algorithms that can also give me a lot of assessment. So we are just making progress.
Thank you. Mr. Anil, I'm sorry to keep you waiting. Please go ahead if you're there. Mr. Anil.
Good morning, Doctor. Well, excellent presentations on the all new things which is happening. The point I have is a different company like Teladoc, which is there in USA, more than $30–40 billion. When do you think it will come to this part of the world, so that we can have the benefit, actual benefit?
It is about saying, when do we want to adapt it? So let me explain it to you. So today, our technology platform is in UK, it's in India, it's in Africa, it's in US as well. It is always about partners. See, think about it. So Teladoc has just bought out Livongo, and they're only looking at chronic care management, right? And I'm sure you heard that it bought out Livongo for $12.5 billion.
Yeah.
So it's a huge opportunity because they understand that that one disease is actually worth a lot. However, they are commercially focused. Whilst what we've realized is that the opportunity has to be about connectivity, rather than focusing on individual problems. So if you say you want Teladoc in Oman, then I'll tell you CleanVantage is available for you today.
Okay, that's
right?
great.
If you say, hey, listen, we want to do manufacturing of the ATMs, that's available today. It's up to us. Like in the smartphone world, remember the first people who really saw that opportunity were the semiconductor industry. And they realized they could get it all done cheaply in China. So look at what has happened to China today. China has become the electronic manufacturer of the world because of the smartphone. Similarly, any country that is forward-looking and starts taking a leapfrog to say, we will start taking leadership in this area, they will develop, because these are all developing areas. These are transformative areas. But you have to invest.
Certainly. Well, I see your contact numbers. I'll get in touch with you.
Absolutely. Anytime.
Thank you, Dr. Thanks.
Well, thank you very much, Doctor. Haji Adam is next. Please, Mr. Adam, unmute yourself and go ahead, ask your question.
Thank you very much, Dr. Abhay. It's a very impressive talk. But I think you are talking to the wrong people here. Most of us, over 50, and we don't understand this technology, and that's the reason, we fight it. The maybe it's not a question, but what I wanted to say, for places like ours in here, maybe a middle point office somewhere, somebody can go, like what Dina was saying. Now they're having problem with the budget and medical centers and doctors. Maybe private medical office somewhere, somebody who can interpret all these things, directly relate to the doctor, will be much cheaper. So this technology can be used for this kind of things. Not on a medical point, but I have a machine, an electronic machine, quite sophisticated. It's an embroidery machine, and something went wrong with it. I have a friend in India, who guided me through the internet with video how to fix the problem. The people here could not fix it. So I called him and he said, it's easy, Haji, just switch on your camera, take it back to the machine, and then after half an hour, the machine was up and running. So I think it's possible. Everything is possible. We will resist. Maybe also some part of the medical industry will also maybe resist and fight because there are a lot of accusations to the doctors that, doctors working for certain hospitals and medical centers, have a quota to fulfill. And with your technology, this will pull the rug under their feet, I think, definitely. And maybe with this technology, not maybe, I'm sure for 100%, it will be much, much cheaper. Like medical treatment here in Oman within private hospital is, is quite expensive, and unbelievably, it's very, very, very expensive. This technology will open, I think, a very, very good door. Of course, people don't like to leave their comfort zones. I heard Dr. Zaid what was he saying? He doesn't want to leave his comfort zone. We are human beings. We all face this kind of thing. So I think you are on the right path, and believe me that once it's in here, I'll be the first one to use it. Thank you very much.
Thank you so much. I'll just share one little snippet with you. If 10 years ago someone had told me that I will buy all my things sitting at home from Amazon and not go to a shop, I would have said, what rubbish, I'll go to the shop. I'm never going to change. Today, 90% of my shopping is done sitting at home. So consumer behavior is what we really need to focus. It's not going to be the doctors or the government or the hospitals that are actually going to adapt the change. It's going to be people. When people start forcing to say, why are you asking me to wait in the hospital for 3 hours? Why can't I get this opinion at home? That transformation, because ultimately it always is the individual that drives the change. So we see the same thing happening. When I look at my kids actually order any food by going on an app from Uber Eats or from Deliveroo. And for them, it is so easy. And I remember for me, it was about physically going to a restaurant. That's the difference. As the newer generations start coming on, they start pushing for change, and the change will come. Thank you very much for your supportive words, though. I really appreciate it.
Thank you. There are a lot of questions, Dr. Isa Rahbi next. Dr. Isa, please unmute yourself and go ahead. Dr. Isa?
Assalamu alaikum.
Alaikum assalam.
Hi. First of all, I'm not a doctor, just to be clear.
Oh, I was told, sorry.
Yeah, hi. My name is Isa. I'm talking to you guys from Boston, Massachusetts, United States of America. I have a question for the doctor.
Sure.
What are you talking about? First of all, excuse me for my English. I'm not that good of an English. Anyway, what are you talking about is basically exists in the United States. For example, when I travel to Oman and if I get sick, for example, I always contact my doctor by email. And by law, they always respond to me and they give me all the information I need. So are you talking about the device, or are you talking about some kind of technology using different between what we're using here than there?
No, so we are actually taking the same concept a lot further. So today, when we actually interact with a remote physician, typically it is about me explaining my symptoms, and based on my symptoms, he giving me advice. There is no assessment part. We are saying that we can start replicating the entire assessment structure. So it doesn't matter whether you're in Oman or whether you're in Boston, you should get the same care. But it shouldn't be superficial care, because if you only base it on history, you can make errors. What about checking you? What about assessing you? What about using AI tools to keep the doctor safe? What about making sure? I'll give you a very simple example. A lot of medicines that we prescribe have side effects, but the side effects are dependent on your profile. There is no tool today, me as a doctor, to actually be able to predict it. But AI can be actually very helpful when I prescribe something to alert me to say, hey, this patient is like that, he's going to get that trouble. Now, this is the future. This is about saying, how can we empower and reduce suffering or unnecessary medical complications? So, look at the kind of interaction we can do. It is not just about giving an advice. Your doctor should be able to see your entire medical record in one go. He can see your medical file, literally like he sees a file when you're in front of him. This medical file is like a book. You can just scroll it, see whatever you want to see. Then you start your assessment. This is about building the tools. So I just feel that the concept that you have currently is right, but it can be taken to a completely different level, whereby it doesn't have to be just between a US doctor and you. It can be for any patient, anywhere, anytime.
Thank you very much, Doctor, for this answer. I do have a question, though. The clinical pathways and the standards of care are not the same worldwide. So how does this tool deal with those?
Two ways. So first of all, the system allows a doctor to modify the platform to practice exactly how he practices today.
Mm-hmm.
But as a regulator, let's assume tomorrow you want to push guidance to the doctor. Yeah. Today, there is no mechanism to uniformly make sure that that guidance is available to the doctor when he's actually looking at that condition. Mm-hmm. So let's assume tomorrow you decide to notify a particular disease. The only mechanism you have is to send an email or a letter to all the doctors and hope that they remember. Mm-hmm. But now with a platform, if you actually say every time you put this as a diagnosis, it will automatically notify. You've mm-hmm. solved the problem. So this is about just thinking how you can use a platform to deliver the care of any standard, but at the same time give the flexibility to the doctor to adapt the system to him. Right. The system is very, very flexible. It's very configurable. Mm-hmm. So all the questions, the doctor will decide what questions to ask. The doctor can decide what medicines to give. Mm-hmm. So it is not that the system is imposing anything on him. I'll show you a very simple snippet here. So let's assume the patient actually has fever. Now, a typical doctor is only going to choose between, let's say, aspirin or paracetamol. So he can create one prescription. He puts all the possible drugs for that condition. Yes. But when he's prescribing, he can just choose a drug. And the moment he eliminates that and says safe, the prescription is gone along with the full advice, full interaction list, full expectation of what side effects. So he doesn't have to keep doing that task again and again. Same with your ordering. So let's assume as an infectious disease specialist, you want to do 20 tests as a fever screen. Do it once. Now, next time you can just choose which of those 20 you really want to go ahead with and what you don't want to do. But by doing that, it becomes an error of, you no longer make an error of omission. You can only make an error of commission. And error of commission are far less than errors of omission. Mm-hmm. So we can make the safety profile better. We can increase your efficiency. We can actually make sure that you can interact with your patients much more easily.
Okay, and this platform is for outpatient care, right? It's not for...
No, it is the same for inpatient as well.
Okay.
So it is available for everyone, whether it's a lab, whether it's a radiology, whether it's a microbiology, whether it's inpatient, whether it's an operation theater, whether it's physiotherapy. Same philosophy applies in every place. So it's configurable.
So my next question, I think we have only 5 minutes if everybody allows me to ask this question from the economic perspective. Let's say someone takes on this project, right? And obviously I need to help people, but I also want to make money, right?
Sure.
So, so what would be the investment that is needed, and what is your experience? Where did it succeed before, and how did it succeed?
So we first of all, we rolled this out. We actually matured our platform earlier in 2020.
Yeah.
But we build a model of partnership. So what I do is, let's assume tomorrow you say, I love the platform. Now, I don't have the local know-how of Oman, or for that matter, understand the standards here. So I'll say, why don't we partner together? And you tell me, you lead the process. I'll give you the technology and the tools and adapt them for your requirement.
Right.
So we do that with every hospital. So the economic part is entirely decided by our partners. We don't try to decide what the cost is or what the implementation is. Remember, as I told you, to me, this is a journey of multiple partnerships.
Right.
And every doctor, I see that if I allow every doctor to be an entrepreneur, this can actually take place very, very fast. Let's assume someone like Zaid, he says, listen, I love what you're doing, but let's make it adaptable to everyone in infectious diseases because I understand the space. For me, it is about providing the tools. I'll say, why not? Come on board. We will build the tools, we'll build the content, and now you can make money out of this. Because remember, this is not about just one solution. What I've built is a Lego block of multiple tools needed in healthcare.
Right.
And you can make any model that you want out of it.
So how do the doctors get involved in it? I mean, do they,
So there are multiple ways. In India, typically doctors have used this as a subscription for their own practice, whereby they actually give the app to their patients. It's very easy. The patients are making more and more appointments, so their practices goes up.
All right. Okay.
There are some doctors who say, you know what, I have a lot of time. I want to build the content, and can I have royalty for that? It's like writing a book. So I say, yeah, why not? You come on board, write the content, and we'll create a royalty. Every time your content gets used, you'll make money out of it.
All right. Okay.
Some doctors have said, you know what, we love that API model where we want to sell this for the whole world. We want to build that part. So let's assume there's a manufacturer who's not got nothing to do with medicine, but got a big factory and is capable of producing devices. I'll say, I'll give you the patent, I'll give you the know-how. Now let's work with your team and let's put a big project together. Because what's wrong about it? So we actually believe that every partner should be able to make money. Economic incentive is the strongest incentive. If we don't have economic incentive, nothing will happen.
Absolutely. Yeah. That's what I'm saying.
And that's the core. We at no point feel that we should be doing anything for free or just for charity, because then that will make my project die. If I want my project to stay viable, I have to build economic incentive for every partner in the journey.
Well, that is very interesting. Thank you very much for just a thought-provoking and quite innovative presentation, Dr. Abhay. I don't know, Riham and Mr. Khalil would, Mr. Muhammad Habib has I think it would be the last question. Mr. Habib, please unmute yourself and go ahead.
Hi, Doctor.
Hello.
You have made it very convenient for the patients to get access to the doctor. That means a bigger demand on the doctors, and there are only 24 hours in a day. What have you done as far as using the artificial intelligence to quicken your decisions by half of the data can be accessed in a millionth of a second for you? Is there a such thing to help you?
Yes, absolutely. So the first thought was, can we make the doctor more productive? There are two ways we looked at this. One is we today think about doctor availability and only in the local area. So we look at who are the doctors around me that I can make an appointment. But remember, if I open availability, you might be sitting in Oman, but making an appointment in Mumbai, a doctor who's available. So that solves the saturation problem. The second aspect is, today, when you speak with a doctor, 70 to 80% of his time is data gathering. I'm saying the data is automatically going to be put in front of the doctor. So now, instead of needing 20 minutes to see a patient, he can see a patient in 5 minutes. So in the same amount of time, he's going to see 4 times more patients. The second aspect of this is also allowed the doctor to standardize his practice. So all the advice that he wants to give to the patient, he can do it once and he can give it again and again. Whatever monitoring he wants to do, the technology will do it for him. So the whole concept here is, don't think about your doctor-patient interaction just as a visit. A visit is just one way, but you can interact with your doctor 24/7 because the data will be flowing between him and you. Think differently. Think about the doctor actually having kind of be there for your data or for your health at all times. And it doesn't have to be in your own country. It can be anywhere in the world. Why can't Oman provide healthcare for the entire Middle East? That's a question I'll pose to you. Why can't I say we can put a health hub in Oman that can supply healthcare to the entire region?
Also, Abhay, you might want to highlight the clinical intel part, which the question was around how AI is going to help augment the doctors make certain decisions faster, and how our platform is focused on this data assimilation and also the AI part where we're doing provisional diagnosis. I think you might want to highlight that.
Yeah. So the system actually has the capability whereby we can even put a predictive engine based on the symptoms. So the doctor will be told that, why don't you think of these 3 systems? That is it COVID? Is it histoplasmosis because the patient's complaining of dyspnea? Is it influenza? So now the doctor is not actually ignoring a possibility, right? In a 29-year-old with 5-day fever, but also getting significant dyspnea, COVID is the topmost diagnosis today. So given on the prevalence at that time, the engine has automatically put that as a topmost diagnosis. See, it is about thinking. And this can only get better with time.
Thank you very much, Mr. Abhay. I think we've passed our time by 5 minutes. Thank you very much, Mr. Khalid, for giving me this opportunity to moderate this wonderful session. Would you like to give some closing remarks, please?
No, not really. Thank you very much. We enjoyed the session, but I'm sure that some people, they want to invest in this technology. So my question is, what if you are planning to build a hospital after this session? To all the investors here, do they think that they are still, doctor, do they still build the hospital, or they go into technology?
No. They should just build smart hospitals. Don't think that we are going to make the transition in one day. It's never going to happen that way. Build your hospitals, but integrate technology in it. Make sure doctors are with you. Make sure your doctors are empowered. See, remember, it is about saying that we will make it better in a gradual fashion. There is no way you can just say we will have a digital clinic tomorrow, because it's not going to work. But if we say our hospitals are going to get empowered, we'll make sure no one has to stand in a queue. Our hospital will have a much bigger catchment because we put an ATM in multiple areas. That's a smart hospital. That's saying that that hospital will be 20 times more profitable than a conventional hospital. That's the way to go about it.
Okay. Thank you. Dr. Zaid, are you convinced?
What? Personally, I bought a Tesla car, which we don't have a dealer in Oman. But so I actually went out of my whole family thinks I'm crazy for, why do you buy this electric car? There's no chargers, there's no infrastructure, there's not even a dealer if it breaks down to fix it. But I have faith in the technology, and when I drive the car, I'm on the highway now, I always engage the autopilot. So I let the car do all of the work and I just observe. So I definitely have faith in this. Maybe I came across as being a naysayer. No, I believe this is what is coming in the future, and you should start now. And I think what Dr. Abhay's approach maybe is similar to Tesla, in that other companies, they made when they wanted to make an autonomous car, they wanted to make sure the car was fully functional before they started using it in the field. Tesla took a different approach. They started to push updates to the car as people were using it. And within a couple of years, it's going to be fully autonomous and it's going to be like that. So I think this is an interesting approach, which is you're really pushing the envelope under the supervision of the doctors and trying to increase more and more automation. I think the ideas of Dr. Abhay, also the fact that it's augmenting the practice rather than replacing it. Also, a very important point that he made is really the patient should own their data. So the patient should have some either in a chip or in the cloud. They should own their data and be able to, their medical record, be able to take it very easily and freely from doctor to doctor to doctor, from country to country. And I think this is probably a priority worldwide, is that there has to be really a standard set for interchangeable medical records and being able to transfer the data easily. I think that will also put pressure on the doctors to provide better care, because really you're now in the service of the patient, and the patient doesn't really owe you anything, directly. They can choose the doctor that is better.
Thank you, Dr. Zaid. We are back to Nick Patterson. He's more comfortable now after taking his injection, and he wants to add something probably.
No, I have absolutely nothing, but thank you both so much for a wonderful presentation. Mind-boggling. Thank you.
Thank you. Haji Adam, you want to add something? Or you want to invest?
No, thank you. Thank you very much, Ustad Khalil. I think the talk was very impressive, like I said, and it's a new technology, and people will resist, definitely. They will not come forward very easily. But honestly speaking, being a senior executive in the government, I see a lot of good future for this technology for Oman here. This technology can give access to people, for treatment in different parts of the world with minimum expenses, with little effort, to travel from remote areas to hospitals and legging around, sleeping outside the hospital, waiting for the patients. And it's a wonderful technology. I think Oman should invest in it, or the private sector in Oman should invest in it. The only thing I was suggesting, maybe, to start with, maybe there should be some labs or some point reliable where people can go and do all the tests and things, and everything should be transmitted to the doctors in time, and get the response in time and arrange for the people, because not everybody can handle this technology in Oman. So these people maybe need to be helped in order to get online with this facility. Thank you very much. Thank you.
Thank you. Thank you, Haji. Back to Khamis Al-Kiyumi. Probably you want to lead the investor together.
Well, honestly speaking, I think you stimulate many ideas, and myself, maybe I need to spend more time in this subject for the coming few weeks, and see to the exercise from different angle. But for sure, I totally agree with you. Transformation is going to happen very fast, and what the world is needed, third wave of COVID-19 or 20 or 21. Then you see this kind of practice will be a normal practice, as we see today a remote education is happening. I think it's a good idea to think about it seriously, and without thinking in border. We don't talk about Oman or Arab countries. No, entire world should be open for any exercise to use this kind of technology. Someone with his solar energy telephone in Amazon forest, he can go to satellite and check his symptoms and send it to any doctor in the world. I think it is a good transformation is coming, and we need to take it very serious. Physical visit, it will be a big challenge for every healthcare everywhere in the world. Thank you.
Thank you, Khamis. Back to you, Dr. Abhay, if you want to say.
No, I just want to thank you all for your very patient listening and fascinating discussion afterwards. So I would just say a big thank you to all of you. If there's anyone who wants to reach out to me or Nilesh, feel free. We've put our number there for a reason. You want to see any specific aspect, discuss any specific opportunity, we are all open ears. Thank you so much.
Thank you, Doctor. Thank you, Nilesh. Back to you, Rehan.
Thank you very much. Dr. Abhay, just before we close, there is a comment from Mr. Mohammed Al-Miskri. So he's saying that there is a presentation which was made on 2019 to the Ministry of Health, and he said you know more about it. So if
I'll
you
just
can
elaborate that. So when the concept was very young, and I was also young 2 years ago, I had come down to Muscat and we had made a presentation. And I think there was a very, very strong buy-in. And I had promised that when I'm ready, I'll come back. So I think it is my turn now to reach out again to the ministry and show them that, yes, now I'm ready. I did deliver what I promised.
Thank you very much.
Sorry, Rehan, just for Dr. Abhay, do you have a list of doctors or centers using your technology in India?
Yeah.
You can share it with us, please.
Absolutely. We can share that. That's absolutely not a problem. The second thing is, like I said, what we've realized is that in every geography, we just need minor modifications. We don't need to change anything big at all. So for instance, we started deploying in Nairobi in Kenya, and we could do a whole remote deployment in 2 weeks for a full-fledged hospital. You know, that kind of disruption is happening because traditionally hospital information system took years to deploy. And now it's happening in weeks. So we will be happy to show you not just in India, but also in UK and in Kenya. Thank you, everyone.
Thank you very much. Yep. Thank you. Dear guests, we have reached to the end of our session for this day. Thank you, Dr. Abhay and Mr. Nilesh for the presentation. Thank you, Dr. Dina, for moderating the session. And thank you, our guests, for participating with us today. Our next session is with Mrs. Lubna Al-Kharousi and her very interesting topic, tapping into your intuition. Until we see you next week, stay safe and have a great week ahead. Thank you very much.
Thank you.
Thank you.